You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
But here's the crazy thing. You talk about Detroit. Black woman works at a hospital, Beaumont Hospital. Turned away 4 times. Deborah Gatewood, 63 years old, started experiencing symptoms in mid-March. Drove herself to the hospital emergency room. Multiple times. Was denied a test every single time. By the time she was tested for coronavirus at another hospital.
Oh my God.
Her fever had hit 106. Had developed bilateral pneumonia. Her kidneys began to fail. Then her heart, April 17th, declared dead. How in the hell, Avis, can you be a hospital worker and your own place of employment deny you a test? She's now dead. I hope her family sues the hell out of her damn hospital.
I agree. They need to sue them for every penny they can get. And there is no excuse. I mean, we've talked about implicit bias. I'm sure that definitely played a role. But this is criminally negligent behavior, if you ask me. I believe that definitely they should sue at minimum in terms of turning this woman away. I mean, she did what she was supposed to do. When you go to the emergency room, legally you are supposed to be seen by a doctor. She worked there. She has a medical background. It's not like she was going there for frivolous reasons, obviously, given the symptoms that she was showing. And the fact that time and time and time and time again, she was turned away from the specific facility that she had dedicated decades of her life to. And then had to go to a completely different space when she already had, unfortunately, one foot in the grave, is absolutely inconscionable. And so, yes, it is a tragedy of epic proportions. And I certainly hope, as you mentioned, that her family sues the daylights out of these people so that they never again show that level of negligence and, quite frankly, that level of just lack of compassion for someone who is obviously suffering and in need of their care.
So, Jason, this White House says, we have all these tests available. Well, why in the hell are we still hearing these stories of people being turned away? I mean, the young brother out of Michigan, 25 years old, set to graduate in a few weeks, again, goes to a hospital, turned away, can't get a test. I mean, this is the problem we're dealing with, and our people are being screwed. Our people are being killed, frankly, by this lack of testing.
There's no question about it. The World Health Organization says that we should be testing 500,000 people a day before we even think about reopening. Last time I checked, we were testing about 150,000 people per day, which is obviously far below where we need to be. Donald Trump, I believe, today got up there and said the federal government is not responsible, that they are the last resort for testing. And so you have some of these hospitals that literally don't have the resources. And then, when you have a healthcare professional who says that they need a test because they're experiencing symptoms, not only should they sue, people who were treated by that healthcare professional should sue, because that puts them in danger as well, assuming that she, maybe perhaps still went to work. So healthcare professionals should be first in line to get tested. There's no question about that. And so I agree with your other panelists that this is unbelievable, unreal that we are in this situation, and our federal government, and in some cases state governments, but for the most part, state governments have tried, but federal government has not had our backs and has not gotten people tested. And as we said, when America, gets a cold, Black people get COVID-19, and it starts taking people out. And so, I'm glad that there are shows like this that are speaking up and making sure that people know this.
Quadricos, I cannot imagine working at a hospital knowing full well hospitals are incubators of coronavirus. A hospital where you have given your time, energy, and talent, and they wouldn't even give you a test, and you have to go somewhere else, and you end up dying of it.
Listen, Roland, I know of 2 cases personally, both nurses, both African-American women. One, she was sick. Thankfully, it was not COVID related. She had the allergies. She's a nurse. She went to her own hospital. They refused to test her. They told her to go home for 2 days and then report back to work. She went to another hospital. They refused to test her. I told her to literally raise hell, to curse and even call the police if she needed so that they could test her. That particular hospital then told her to go home. She recovered. Thankfully, she just had the flu and was seasonal allergies, and so she was able to recover. But the reality is hospitals are not treating African-American patients. And I'm hearing anecdotal stories that this is the case. They're rather sending them home because they're at capacities, and particularly if these hospitals and these clinics are in African-American and underserved communities, they're very simply not treating them. I don't necessarily have the data on this, but I am hearing anecdotal stories. I also heard a friend of mine who literally quit, very similar to the physician that committed suicide because she could not take the anxiety of potentially coming home and giving her 2 small children COVID-19 as well as her husband. So she quit. And what's not being reported are the anecdotal stories that we are hearing consistently, given the implicit bias in our healthcare system, that African Americans and other underrepresented minorities are not being tested or treated.
Well,
I gotta ask y'all this here. Now you have Senator Majority Leader Mitch McConnell, because this ties to this here, who in the next coronavirus bill, he wants to demand that companies that force their employees to come back to work have liability protections, meaning they can't be sued. Take it away, Jason.
I mean, this is Mitch McConnell, and this is why he's actually, I believe he's in trouble. I mean, more than likely he will win re-election, but he's in more danger than he's ever been in his career because he's cold-hearted and callous and thinks about dollars over people. And that's one of the things that we're seeing with the Republican Party right now is that they think about pocketbooks over people. And I think, hopefully some people are waking up and seeing that, this is not tenable. This is untenable. And this is not a way, that you govern it. And one thing I'll say to Quadricos is that, first of all, what's up, Quadricos? We know each other. But the other thing that I would say is, like, my wife is a nurse. And while there are problems with healthcare, I know her biggest concern, because she deals with vulnerable populations, was about getting COVID-19 and then passing it on to patients because in the beginning, her job didn't have PPE. So I think that, while there are a lot of healthcare disparities and health outcome disparities, there are a lot of professionals who are worried about patients. They're absolutely concerned with patients, particularly Black and Latino nurses and doctors who are really concerned with that. And concerned that they didn't have what they needed to do their jobs. That was the big concern that I heard from a lot of doctors and nurses.
Mm-hmm.
Avis.
Yeah. I mean, here's the bottom line.
I mean, liability. I mean, so the hell, so forcing people. Oh, guess what? Hey, y'all get sued. Don't worry about it. No liability whatsoever. We already saw that where Florida Governor Ron DeSantis was trying to do the exact same thing to the nursing homes where bodies have been stacking up for the last 2 months.
It is unconscionable. It just lets you know that who they value and who they don't. Well, the fact that, quite frankly, they don't value anybody, clearly. They don't value human life over financial interest. That's really what we're seeing here. And that's also what we're seeing throughout this administration. The reason that we're having the problems that we're having right now, just in terms of at the scale that we're having right now, is because from the very beginning, this administration was negligent in its decision-making. When it got rid of President Obama's pandemic response unit from day one, when it completely sort of basically sold our stockpile to China, and then did not replenish it, okay? When it also has specifically, I believe, intentionally suppressed testing efforts so that it could appear that there are less people who are suffering with this disease than there actually are. And that's why Trump today has said that it's not our responsibility as the federal government, knowing good and damn well that states are under much more financial restrictions than the federal government is. And he's created this situation where states have to compete with each other and figure out how they can get supplies that the entire world is trying to get. All the time here, you have a president who has also refused to fully enact the Defense Production Act, which would force companies to make the materials that we need to be able to keep healthcare providers protected, as well as provide enough supplies so that people could be tested and people could have access to those things that could save lives. At the foundation of this problem is the complete idiocy of this administration, the complete callousness of this administration that really cares nothing about human life and clearly only values profit. And unfortunately, in those circumstances, everyone is at danger, but the group that tends to pay the highest price, unfortunately, is African Americans.
Puerto Rico's final comment before we go to a break.
Ava's is absolutely right. This is just, unfortunately, evidence time and time again that America will be and continues to be America, that it necessarily does not care about the most vulnerable and the poor of our society, and that includes Black and brown people. It's about profit, and we have to continue to make sure that our voices are heard and that we continue to raise hell, whether it's to our members of Congress or whether it's to our local and state legislatures, to ensure that our voices are heard and that we get the care that we need.
Every single night. We've got some of the top Black experts. You're not going to see them on cable news or broadcast news because you swear Black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first Black Surgeon General, Dr. Joycelyn Eldridge. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. TSHAKA Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock, Desmond Meade, president of the Florida Rights Restoration Coalition, Cliff Albright, who is the co-founder of Black Voters Matter, Michael Harriot with The Root, Mina McWhorter, founder of Love by the Hand, Dr. Julianne Malveaux, economist, president, Emerita Bennett College, coroner Michael Fowler, is a mayor of Atlanta, KEISHA Lance Bottoms, mental health therapist Suzette Clark, Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr., Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District, Dr. Leon McDougall, president-elect of the National Medical Association, Jana Bailey, Roland, Mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.